coronavirus is leaving some lasting effects on all survivors. Fatigue, shortness of breath, hair loss and muscle pain remain a few of them. Our next report tells you how COVID-19 survivors are bearing the consequences even after testing negative for the infection. Take a look.
Many people who had serious cases of COVID-19 are dealing with its long-term effects months after leaving the hospital. In Barcelona, 56-year-old Pablo Aguilar is one of them. He spent 3 months at the hospital, 1 month in the ICU. It's been 5 months since he left the hospital.
The truth is I am surprised because I thought that at this point I would be walking better. The long-term effects that have remained, they are tremendous. I get tired. I have become afraid of going out in the street alone. I have a small dog. Taking the dog out I considered a big responsibility. I don't care.
Aguilar is part of a group of COVID-19 survivors participating in a rehabilitation program in a Barcelona public hospital. Activities include exercises to strengthen muscle, improve balance, and aerobic capacity. Another participant, Eulalia Canella, a mother of 2 and a 49-year-old nurse, got infected while taking care of virus patients. She was never hospitalized but suffered from pneumonia and was bedridden at home for a month. In the summer, she thought she was getting better but noticed new symptoms popping up: hair loss, numbness in the hands and muscle pain. Not a day goes by without a headache, she says. Recently, doctors discovered her lungs weren't working properly, hence affecting her kidneys.
Your active time reduces itself to 3 or 4 hours a day. The rest of the time you must be on the sofa stretched out or resting. Dinner time comes and you must tell your kids, make yourself whatever you can because mother cannot get up from the sofa.
Dr. Esther Marco oversees the rehabilitation programs Canella is part of. She also had COVID-19 in the spring, but unlike her patients, recovered quickly and is now back at work.
We have 2 big groups of patients who are untrained from being in the ICU, for example, who get tired and have muscular pain and can feel like they're running out of breath even when they're resting. And then you have another profile of patients who have difficulty swallowing or difficulty speaking.
Marco estimates some 15 to 20% of COVID-19 patients who were hospitalized will end up needing serious rehabilitation. Spain has the 6th highest number of coronavirus cases in the world, with more than 1.5 million people infected since the beginning of the pandemic. Mariama Diallo, VOA News.